Have you got an NHS interview coming up and you're nervous because you don't know what to expect? Well, you've come to the right place. Stay tuned and I'll give you a list of NHS questions and how to answer them correctly to land your dream job. Hey lovelies, welcome back to my channel. My name is Sharry. If you're new here, I talk about work, life, and how to come to the UK. So if this is the kind of content you like, please consider subscribing, like, and share these videos to help others as well. Okay, so in today's video, we are going to be talking about NHS interview questions and how to answer them correctly. If you have an NHS interview coming up, it's okay to be nervous. Be honest, no one likes interviews. But you just have to remember that it's a bridge you need to cross to get to your destination. In today's video, I'm going to give you a list of NHS Band 5 interview questions, which you should prepare for if you have an NHS interview coming up. It's tell you how to answer them correctly as well. So the first question is, how would you cope or manage stress at work? Give them a work example, how you dealt with it, and the lesson you learned, as well as every situation is a learning opportunity. Tell them how you remained calm and escalated the situation to your senior colleagues, how you delegated tasks to your junior colleagues as well, based on their individual knowledge and competency. And also let them know that you take a break if it is safe to do so. But the next one is, what is sepsis and how would you manage it? Bear in mind that NHS does not joke with sepsis at all. This is one of their most common questions I was asked in my interview. So for this question, you need to tell them what sepsis is and how you manage it as a nurse. So firstly, define what sepsis is. So sepsis is a life-threatening medical condition where the body's reaction or response to infection results in tissue and organ damage, and if not treated promptly, can result in septic shock. So in the UK, sepsis is managed by a treatment pathway called Sepsis Care Bundle. So I'm going to give you what this bundle consists of and what they expect you to take. The first thing is to give your patient oxygen to maintain oxygen saturation levels of 94 to 98, unless the person is a CO2, which is carbon dioxide retainer, where their target saturation is 88 to 92. And 2, you need to take blood for cultures. And 3, give IV antibiotics. This IV antibiotics is given, as I said, within the first hour of symptoms recognition. Number 4, you need to give IV fluids. 5, you need to take blood sample for lactate levels, ABG, VBG, and other routine bloods. And then 6, you have to monitor the patient's urine outputs hourly. So if the patient is not having a catheter, you need to catheterize them. And after all this intervention and per your nursing judgment, you think the patient is still poorly and is not improving, you need to escalate immediately. So this is how to answer this question. The next question is, what would be your action if you make a mistake while treating a patient? So with this kind of question, they are not trying to trick you. They know nurses are humans. We are prone to make mistakes. So what they want to know is whether you will acknowledge your mistake and report them, or whether you would cover them up. So don't go telling them that, oh, I'm very serious about my work, I don't make mistakes, I've never committed a mistake in my entire nursing life. Nurses, we are humans and we make mistakes, and those interviewing you know that. So this is how to answer it. As nurses, we ought to be very careful when dealing with our patients. However, if I should make a mistake while treating my patient, I would observe the patient, take a full observation, which is your vital signs, and then escalate immediately to your ward manager, and the doctors will be notified if need be. I'll also follow my supervisor's instruction, go to the patient and explain the situation to the patient, as this is my legal duty of conduct as a nurse. It's your legal duty as a nurse to tell the patient if things go wrong. So you have to include that duty of conduct in your answer. So you tell the patient about your mistake and apologize appropriately. You complete an incident form and then take a moment to reflect about what happened, what precipitated it, and how you can prevent that mistake in the future. Next question is, how would you deal with conflict at the workplace? So in answering this question, you need to say that as a nurse, you try to prevent conflict at the workplace, as the hospital is supposed to be a safe place for the patients and the health workers as well. However, if conflicts occur due to differences in opinion or personality, I'll remain calm, listen to my colleague without being judgmental, and also relay my opinion rationally. And you can also add that because you've got good conflict resolution skills, you sometimes act as a mediator between colleagues when they have conflicts, and then give them a short scenario of a conflict that occurred at your workplace and how you resolved it amicably. So the next question is, how would you maintain patient confidentiality in the workplace? So you need to explain what confidentiality means and then give them ways that you would maintain patient confidentiality. Confidentiality is a key aspect of the healthcare, and it's important to build patient trust as sensitive information are involved. According to NMC 2015, confidentiality is a legal duty of every nurse, regardless of your location. So, number one, patient's information should only be shared to a third party after the patient has consented to it. It doesn't matter if the person is the patient's family member. Sometimes the patient do not want their parents or their family members to know about what is happening. So you don't want to be the person breaking the news to them. So you only tell them after the patient has given you his or her consent. Number two, at the workplace, I would ensure that patients' notes and test results are securely stored away to prevent unauthorized people from accessing it. Healthcare workers should not be heard discussing patients' condition at inappropriate places such as the eatery or on the corridors, etc. This is one of the things they are very particular about. Confidentiality is a big thing in the UK. The last question is, what brings you self-fulfillment as a nurse? For this question, you need to tell them how patients come in very ill and poorly. However, due to the quality care you render, they become appreciative on discharge. And even for the terminally ill ones, they and their family compliment and appreciate you for making their last days comfortable and pain-free. You can give them a scenario if you've got one. So for the NHS interview, you just need to be confident and smile. Even if you don't know the answer to the question, answer it to the best of your knowledge. Don't leave any question unanswered. And make sure to answer the next question correctly to cover up for the ones you couldn't give your best response. So if you've got an NHS interview coming up, I'm wishing you the very best. If you find this information helpful, don't forget to give me a thumbs up and share it to your friends and family who have got NHS interview coming up. If you've got any NHS interview question which you would want me to help you with, please leave it in the comment section and I'll get back to you. If you haven't hit the subscribe button, please do so to encourage me to make more videos. So until my next video, take care of yourself and stay safe. Bye.